this video, we hope to provide you with a better understanding of muscular diseases, specifically Duchenne and Becker muscular dystrophy. We will start off by addressing muscular dystrophy and the associated mutations. We will then proceed to address Duchenne and Becker muscular dystrophy, including its discovery, symptoms and diagnosis, as well as prevention and treatment. We will end off by providing a meaningful comparison between the genetic and cellular mechanism of Duchenne and Becker muscular dystrophy. This is particularly important because although both conditions are extremely similar, there are differences that can allow for an early diagnosis, leading to the implementation of prevention strategies sooner rather than later to maximize the quality of life. We will be starting off by providing a general overview of muscular dystrophy.
Every cell in our body is coded for by special instructions called genes. Together, these genes make up our DNA. Our body works hard employing various proofreading mechanisms to ensure that the right instructions are used to create cells that function properly. However, this is not a perfect system. Instances where points of the instructions are changed are called mutations. Mutations can range from harmless to very severe. We would like to highlight two types of mutations, deletions and duplications. Deletions occur when a part of the genetic code is missing, while duplications occur when extra sequences of the genetic code are added. Muscular dystrophies is a class of conditions caused by genetic mutations. This class is characterized by progressive muscle weakness and loss of muscle mass. Over time, this decreases mobility, makes it difficult to complete everyday tasks, and can lead to deformity. There are 9 types of muscular dystrophies, each affecting different areas or combinations of areas in the body. The ones we will be discussing today are Duchenne and Becker muscular dystrophy.
Moving on, let's start to discuss Duchenne muscular dystrophy, also referred to as DMD. This disease is characterized by mutations of the DMD gene on the X chromosome, which can lead to progressive weakening of the muscles in our bodies, eventually leading to death. It was originally discovered in the 1860s, but it wasn't until 1986 that the gene responsible for the disease was located on the X chromosome. Let's take a deep dive into what makes this disease unique and how we can respond to it effectively. Some of the first things that patients afflicted with the disease may notice include difficulties with walking, rising, abnormal clumsiness, and other types of weakness in movements of the shoulder and pelvis regions. They may also experience difficulty with climbing stairs, walking on their tiptoes, some leg pain, and facial weakness. Generally, the age of onset for DMD is around 3 to 5 years old. As the condition progresses, it can start to affect muscles responsible for breathing and the cardiac muscle tissue, resulting in breathing difficulties and an irregular heartbeat. One of the ways in which DMD can be diagnosed is by looking at a person's family history, given that it can be genetically inherited. Genetic testing may also identify the disease, however, it can be fairly expensive. Other diagnostic methods include blood testing for elevated creatine kinase levels. High levels of this enzyme are thought to be predictive of the onset of DMD, as this enzyme is present in muscles that break down. Some other characteristics that might be useful for a diagnosis can include scoliosis, a curving of the spine, pseudohypertrophy, muscular enlargement through the accumulation of fat, as well as reduced reflexes, problems with balance and coordination when walking, and other issues related to the heart muscle. While there is currently no cure for DMD, there are numerous therapeutic options that can help delay symptoms of the disease. These can include physiotherapy to prevent muscle weakness, respiratory therapy to maintain breathing ability, and speech therapy to prevent breakdown to the muscles of the face. Surgery can also be an option to prevent the onset of more serious symptoms, such as through the implementation of a pacemaker to address problems with the heart's rhythm, or through the correction of scoliosis to maintain breathing. Medication, such as steroids, can be prescribed to reduce the speed of muscle weakening and improve muscle strength. Immunosuppressants to delay damage to the muscle cells, seizure medications to address muscle spasms, and beta blockers to slow the heart rate and delay the onset of associated heart muscle problems. Gene therapy is another option, however, it is not widely accessible for treatment.
Moving on, we are going to cover Becker muscular dystrophy, which is also a progressive muscular degenerative disease. Becker muscular dystrophy was named after Peter Emil Becker, a German physician who discovered the variant in the 1950s. Patients with this variant face various symptoms by their teen or young adult years, such as difficulty walking, pain in their muscles or muscle spasms, walking on their toes, tiredness, being intolerant to exercise, or frequently falling. This form of muscular dystrophy is diagnosed using blood tests that look at creatine kinase levels.
Creatine kinase is a form of protein mainly found when muscle cells are damaged, as mentioned previously in DMD. Similarly, using blood tests, doctors can determine if the dystrophin gene is present. Electrocardiograms, also known as EKGs, use a device that records the electrical signals produced by the heart. In this case, it can be used to detect heart damage caused by the dystrophin gene. Furthermore, a muscle biopsy may be performed by taking a tissue sample using a biopsy needle. Using this method, doctors can determine if the muscle contains dystrophin. Decreased levels of dystrophin found around the muscle fibers are an indicator of Becker muscular dystrophy. Finally, there are various treatment methods as Becker muscular dystrophy cannot be prevented or cured. These methods include using corticosteroids, an anti-inflammatory medication, ACE inhibitors, and beta blockers for cardiomyopathy, a disease which affects heart muscle, as these medications lower blood pressure and heart rate respectively. Alongside medication, rehabilitation can help patients' mobility and overall quality of life. Patients can also opt to get surgery for scoliosis and contractures, which is the tightening of the muscle or tendons.
Duchenne muscular dystrophy versus Becker muscular dystrophy, the similarities and differences. The symptoms of both Duchenne and Becker muscular dystrophy are extremely similar, however, differences do exist. The age of onset for Duchenne muscular dystrophy is between 3 to 5, whereas for Becker muscular dystrophy, it ranges from 11 to early 20s and is highly variable, meaning that it can even take place later on in life. In terms of the diagnosis, for Duchenne, a clinical evaluation is performed alongside a thorough analysis of patient history, molecular genetics testing, as well as surgical interventions in some cases, whereas for Becker, physical symptoms and family history are assessed. Blood testing is performed as a diagnostic procedure for both conditions as previously discussed. Duchenne muscular dystrophy is known to progress rapidly, resulting in a decreased life expectancy and an increased chance of health complications, whereas Becker muscular dystrophy progresses at a slower rate, which leads to an increased life expectancy and milder health complications. There is no treatment for both forms of muscular dystrophy. However, strategies to manage symptoms do exist. In both cases, physical therapy is advised to keep the body active and in motion, surgery to treat contractures and scoliosis, as well as medication, specifically corticosteroids, to maintain muscle strength and limit disease progression. The life expectancy for Duchenne muscular dystrophy is between 20 to 30 due to its early onset and rapid progression, whereas the life expectancy for Becker muscular dystrophy is 40 to 50 due to its slow progression and late onset. The genetic mechanism responsible for both Duchenne and Becker muscular dystrophy is identical, as these conditions are characterized by having an X-linked recessive inheritance pattern. This indicates that the mutated gene is located on the X chromosome of the affected individual. Since females have 2 X chromosomes and males have 1 X chromosome, these conditions are most likely to affect males. The Punnett square demonstrates the offspring of an unaffected carrier mother and unaffected father, resulting in a 25% chance that their child will inherit Duchenne or Becker muscular dystrophy, with a 25% chance of the child being a carrier of the disease. These outcomes can vary depending on the genotype of the mother and father. Overall, to inherit these conditions, the defective gene must be inherited either from the mother or their father, or both, for the child to express Duchenne or Becker muscular dystrophy. The cellular mechanism responsible for Duchenne and Becker muscular dystrophy is caused by the inheritance of the defective dystrophin gene on the X chromosome. The DMD gene is the largest human gene, which makes it highly prone to mutations and functions to synthesize the dystrophin protein. Mutations in the DMD gene are caused by deletions and duplications, which as a result disrupt dystrophin production. Insufficient dystrophin production is extremely detrimental to the body, as it leads to the instability of muscular structures, specifically compromising the strength and integrity of muscle fibers across the body. This interferes with the ability of the muscles to contract and relax effectively and increases the chances of injury. The mutation in the DMD gene causing Duchenne muscular dystrophy leads to the complete absence of the dystrophin protein, which explains the rapid disease progression and the low life expectancy. Whereas the mutation in the DMD gene causing Becker muscular dystrophy leads to very little production of dystrophin, which explains the slow progression and the higher life expectancy. Duchenne and Becker muscular dystrophy are extremely rare muscular diseases. Duchenne muscular dystrophy impacts 1 in 3,500 males, with 2.8 cases per 100,000 individuals, whereas Becker muscular dystrophy impacts 1 in 18,518 males, with 1.6 cases per 100,000 individuals. Distinguishing between both of these conditions allows for growth in terms of disease prevention and treatment strategies, which could possibly lead to a cure. Being able to decipher between the two not only spreads awareness that could lead to a quicker diagnosis and treatment plan, but this can also better accommodate the individual to receiving services that will improve their quality of life. Thank you for watching. We hope that you were able to learn more about Duchenne and Becker muscular dystrophy, and that you are now able to distinguish between the two from the knowledge that you have gained.